Welcome to the Mentors and Moguls Podcast. I'm your host, Heather Stone. I bring you mentors and moguls from all around the world, different walks of life, from creatives to CEOs to business leaders to top athletes and all kinds of other people in between. Dr. Selene Castrejon is a leading authority in all things med spa, all things Botox, and all procedures that you can find in a med spa today. I couldn't think of a more perfect person to dispel some of the myths and talk to us about some of the safety guidelines and the best practices for everything that you're doing in your local med spa with Botox, fillers, and the like. Dr. Selene is not only a med spa founder of BU Medical, but she's also been an ER physician for many years. So she's going to give us the down and dirty on the to-dos, the what not to-dos, what to look out for from your med spa doctor, and what might be best for you. So stay tuned for a very interesting 30 minutes with Dr. Selene. Welcome to the Mentors and Moguls Podcast, where today we're talking about all things youth, Botox, and cosmetic tricks with the famous Dr. Selene. Hi, Dr. Selene. Thank you for joining our show today.
Hi, Heather. Such a pleasure to be here. You look amazing.
Well, thank you. And in part, thanks to you. I am so fascinated with all of the things that are cutting edge in your industry. And I know that our listeners have a ton of questions for you. So I'm going to read you a few, and maybe you can help us navigate what you should do, what you shouldn't do when you go into the doctor to say, I want some Botox or some touch-ups, and what's a good practice and a bad practice. So let's take it away. All right.
Yes.
When is it too soon to start Botox? A lot of the ladies want to know.
Number one, I'm Botox's biggest fan. It's on my Tesla license plate. I think it's an amazing medication. When I was in medical school, I actually asked for Botox when I was in my early 20s. And the physician that I saw was like, you don't want to go down that slippery slope. Keep in mind, this was in the early 2000s when Botox had just been discovered for aesthetic purposes. It had been used for medical purposes before, but we hadn't really known that it helped with, initially was found to help decrease little crow's feet and wrinkles there. It was used for blepharospasms, eye spasms, and they found that these people started to lose their wrinkles. And so it was this beautiful discovery of a medication that they're like, wow, it's got great side effects. At the time when I was in my early 20s, I was told, no, you don't want to go down that route. And since then, we've really found that prevention is key, just like in all of medicine. And so what I say is the best wrinkle is the one that you never form. So especially in the areas in between the brows or forehead where it can make you kind of look more upset or angry. And so it's a really beautiful thing. And what I've found is that the younger generation now is a lot more expressive than what we might have been, when we were growing up, with their TikToks or being on camera. They're doing a lot of expressions, which is actually causing a lot of static wrinkles or static lines in the face. And so if we can calm that down where we still have expression, we can still smile, we can still show concern, but relax the wrinkle, it's good. So I always say it's very dependent on the person who's sitting in front of you. But even in some people, in the case of their early 20s, they can take Botox just to prevent that wrinkle from getting deeper. And you may not need as much when you're younger. The company recommends around 64 units. But if in different cases, you might say, hey, I don't want that much. I just want to start really light just to soften things up. That's fine. What we want to do is just keep you on the path of stopping that wrinkle from getting too deep to then where we have to do other methods that are a little bit more invasive.
Okay. So how often should you do Botox for preventative maintenance?
So the company is on label for saying that it should be every 3 to 4 months. It depends on the dose. So that goes back to what we were talking about. The company says 64 units. In some people that I get to only see every now and then twice a year, I'm going to load them up because I want it to last as long as possible. So dose equals duration. So if you're only getting 10 units, that may just last you a month. And it also depends on the strength of your wrinkles and how expressive you are. So if somebody's sitting in front of a computer or has bad eyes and they're straining all day and creating the muscles in between their eyebrows to form, then they might wear it off a little bit faster, just like somebody who's super athletic. And remember, Botox is a protein, they might go through it a little bit faster as well. So it's very dependent on each individual.
I didn't realize that makes a difference if you're an active person versus being more calm, sedentary, academic. I'll put it that way.
Yep, absolutely. And so I always say like a chubby face is a young face, but it also holds on to the Botox more just because you're not burning through everything as fast.
Very interesting. All right. So one of the big things that I see, I'm born and raised in Southern California. I don't live there so much now, but I see a lot of gorgeous women that have had a lot of treatments. And the one thing that I want to just grab them and say is, okay, the Botox in the rest of your face is fabulous, but what are you doing to your lips? I think you need to calm it down a little bit. Why do people do this? How do they prevent this? You can have plump lips, but do they all have to look like duck lips?
Absolutely. I totally agree with you. I think the thing with women is that sometimes we get carried away, and a little too much of a good thing is too much. And so it's really important to have a physician and even your girlfriends put boundaries on you. Because I totally agree. When I do work in Southern California, I'm like, who let you do this? Because, and I dub myself Dr. No, because I probably turn away 10% of my clients on any given day, just because it's not in their best interest. And at a certain point, filler can migrate, your lips can look ridiculous, and it actually ages you. Unfortunately, what I think has happened, I think social media is great for a lot of things, but one of the things that has happened is that we've prototyped what beauty is through filters and whatnot. That's just not reality. And we try to take our anatomy and mold it into, let's say, a Kardashian. Well, our anatomy isn't that same way. So that's just never going to happen. So it's this attempt to make, let's say, somebody with tiny lips into big lips. It just looks awkward, just like you were not created to have that type of anatomy. So you really do need somebody to pump the brakes, even if it's on yourself. And what I noticed is the other really fascinating thing is with movie stars is you have to be really careful with the ultra beautiful woman. And so I always say there's two people that are really hard to inject. It's the beautiful woman, because you can make them look weird fast. So they can start looking like cat lady really quickly. And then the really thin woman. So those are the ladies that I have a hard time with, because they're really beautiful. You never want to take them over just that little bit over the edge to make them look weird. And so that's never our goal. And I'm a big believer in dissolving filler and dissolving what looks weird. And if you've seen Courtney Cox, how she dissolved, if you see her before and after, just Google it, you'll see a significant improvement in her aesthetic after she dissolved all that weird looking, overfilled, about to pop balloon appearance.
Wow. So I didn't know you could dissolve filler. Is it fast? Does it take a long time if you've screwed up and gotten too much?
It's a process, it's not the detailed process. And I always say when you're finding a place, make sure that they know about dissolving, because there are some risks associated with fillers. And so you always want to make sure that that's on hand. If you were to get into a vessel, you would want to dissolve it right away. That's really the main emergency that we face in aesthetic medicine. But also, if it's not looking good, I see patients that I injected a decade ago, and I say, I don't like the way that has aged over time. I'm going to dissolve it, and I want you to trust me in the process, because it's an imperfect science. You don't know that it's fully going to dissolve all the way, but you know that aesthetically will take a little bit of volume loss to not look puffy or migrated filler.
Interesting. Okay. Well, we're going to get away from the face. Thank you for that. I'm sure everyone is thinking, oh, thank goodness I have some real information, right?
Yeah.
Let's talk about all of the other treatments. What are some of the most popular cutting edge treatments that maybe people don't know about that you have really good results for, saying, hey, this is out there. Why don't you know about this? Go ahead and share with us, would you please?
Yeah. So every year we're coming up with new things. And the key is, does it really work? So like for me, we're totally results oriented. We try a lot of different methods, whether that's radio frequency, microneedling, energy. There's a lot of new energy-based lasers that come out yearly. One that I really like is the Profound or the Morpheus. A lot of people have heard about that. That gives you a little regeneration and collagen, elastin, hyaluronic acid. Those are great options for people who don't want to put needles in their face necessarily, or put something foreign in their face. So I love that as a precursor to eventually, potentially a facelift, because as of right now, we don't have the technology that does what a facelift can do. But we have methods that are non-surgical, that are less invasive, that are really helpful. And that's one of the mechanisms that I found really great. I love ablative lasers, which, resurface the skin, help with skin cancers. There's all different types. What you really want to be looking for is just making sure that the place that you go to does plenty of them and is not just a sitting machine in the corner that's only used once a month. You want people who are doing this regularly and really understand the science behind it and how to place it, because all of these can have adverse effects if not used properly. Every year there's new things coming up with fat killing, body sculpting, all those fun things. Again, not replacing liposuction, but giving us an alternative to the more invasive procedures. They're beautiful options that are non-surgical. You should never get promised a result that equals a surgical result, because that's just not true. It's not going to happen. And at a certain point, hopefully you have a trustworthy injector or practitioner that would say, hey, for your goals, really the best option would be surgery. If you don't want to do it, here's the other 3 options that we have.
Nice. So it's hard to really know. I guess trust is the main factor here, is to trust and really vet out whoever is going to be altering your look in any way. You need to know what their past is and what their other clients look like and what their qualifications are, correct?
Absolutely. And also, I think one of the main things is if they will tell you, hey, we don't have that, or refer you out, you automatically build trust, because you know that their goal is your goal. And so I think whatever that might be, or saying, hey, I don't have that for you, or even turning you away for filler,
right?
That's a good practitioner.
Right. Well, you are the leading authority in the US. Just so you know, this is a fact to my listeners. You are the leading authority on all things Botox and then some. So if people want to look you up, I highly endorse you, but they can look you up and see all of your qualifications, which we're going to get to a little bit later in the show. You're just not the Botox queen. You do so much more. And that immediately builds trust. So having said that, how about that cool sculpting? Does it really work? I've heard rumors that cool sculpting is great in the first time, but then it might cause after effects later that keep you from burning fat. Is that fact or fiction?
I think that would be fiction. I have not heard that. I know that with cool sculpting, you have to be the right candidate. So if somebody is obese, I say lose your weight, come back with your problem spot, and then we'll treat that. So the company, when I was first learning it, they would say, hey, you could use it for debulking. And I don't feel like that's very fair to the patient. I feel like problem areas where you just couldn't get to with diet and exercise alone, like a mama pooch post-baby, bra fat is really hard to get to. And you just don't want to go under liposuction. I can say after my babies, it scared me to go under the knife just because of anesthesia. It was an unfounded fear, but nonetheless, I didn't want to do it. It was a great option for that mama pooch or just little problem spots. That's where I feel like it shines. So again, it's picking the right person for the right treatment with the right expectations. And there's been, hype about adverse side effects. Those are very small. Of course, if a movie star, something happens to them, you're going to hear about it. But those cases are incredibly rare.
Good to know. Good to know. Do you need a lot of series, or is it really depending on the person?
So I only sell it in a minimum package of 2 times in the same place. I won't even touch you if you're only going to do it 1 time with one little area. So I personally mostly sell 8 to 15 cycle packages. And that's where I feel like you'll see results. It's the same as with Botox, same as with cool sculpting. You don't get the right dosage, so to speak, you're not going to see the results.
Good to know. Good to know. And then what about those wonderful machines do they send an electric pulse to your muscles to help tone your muscles instead of doing 500 sit-ups every day? Can you get some extra help?
That's like my dream come true. So when I bought, I always said my superpower would be to exercise, have someone exercise on my behalf. And I personally bought the M-Sculpt, which I rave about. And really it comes down to muscle building. And so aesthetically, it looks beautiful because you get a little 6-pack, you get a little bubble butt. It's very cute. But also just strength wise, you do notice a difference when you bike, you exercise, you do your yoga. So even if you don't get the aesthetic result of the 6 or 4-pack, it does really work for strengthening. And yeah, it's like my miracle machine.
Wow. Okay. Well, maybe I'll have to come and give that a try someday. And then for ladies that are afraid to ask, you go a little further down south of the body and you do some rejuvenation work.
Yes.
Talk about that. Does it work? What is it? And tell for the lady who's too afraid to ask anybody, go ahead and talk about the benefits and what that is.
So one of the things that I feel like we as women don't talk about very much is our sexual health, which I have made some videos just saying how important it is. And what we don't talk about is that a lot of women don't orgasm, don't lubricate, and don't have very much sensation, especially after having babies. It just gets a little bit more challenging. And with hormone changes, we just experience vaginal dryness, other things that make intercourse more uncomfortable or not even pleasing. And so what we have in our clinic is called the Intima, which is a laser that goes intravaginally, kind of like a speculum does when you're having an OB-GYN exam. And it releases a laser beam all across the vaginal wall. That ends up doing it, and it doesn't hurt because you don't have a ton of nerve endings inside the vagina. And what it does is it regenerates that whole area, and it kind of stimulates all that area. So it gets the sensory glands to work again. It gets the mucosal glands to work again to help with lubrication. And it also tightens the area. You can also do some extra passes along where the bladder sits right above the vagina. And you can kind of reinforce that problem that happens when you sneeze or you jump on a trampoline and you urinate a little bit. That happens even if you haven't had vaginal babies. Even just the pressure of being pregnant and you've had C-sections can cause you to dribble a little bit, and it takes that away. And more importantly, at least for a lot of women, it's just the stimulation and the sensation and not needing to use as many lubricants. And it's incredibly successful if done appropriately. That one is also done in a series. And a lot of the things that we do, if you look on Real Self or reviews, they're kind of mixed reviews. This one pretty much has raving fans.
Okay, good to know. Ladies, you're welcome for that gift of knowledge right there.
Yes.
You have so many products and so many things that you do at your spa. But one thing is an exciting new product. Do you want to talk about it?
I'd love to.
Okay, go ahead. Everyone, you're hearing this here first. Go ahead.
So one of the things that I found in practicing medicine was that I wanted to keep things really simple, where things weren't too complicated. I feel like when I was going into Ulta, Sephora, I was just overwhelmed with the different options. And like I've already mentioned, I'm all about being results driven. And so I wanted to start looking into the incorporation of CBD into skincare lines. About 3 years ago is when I really piqued my interest, because I feel like it was an understudied area that could potentially have amazing benefits. And so I've been working with this skincare line that I've created over the years that really helps with just antioxidant healing, all these beautiful factors that come out of it while moisturizing. So I feel like that's one of the key things in our skincare line that's missing, that people don't think about hydration. But if you have a moisturized face, or even if you look at your girlfriends that have really oily faces, you'll see they age much better than the girls who have dry faces. And so it ends up being a blessing in disguise later on in life for anti-aging. And so I thought, why not combo the beautiful benefits of some things that are kind of oil, serum based with the CBD and blend this together to give this amazing moisturization with some healing properties with it. And that's how I came up with my skincare line.
That's fantastic. Well, I know that everyone can't wait to get their hands on your product. It is not yet launched, but we're going to have you back on and announce to our viewers the big launch, where they can buy it and how quickly they can get it shipped to you. Would you like to say the name of the product at this point?
Yeah. So we called it NLS, which is my name spelled backwards. We do things a little backwards. So this is a high luxury, hand curated, high grade content of CBD. It's a beautiful product. I am so excited to bring it to the masses. And I think it's going to be a game changer in most people's aesthetic journey.
I'm excited. I'm excited to give it a try myself, because I need the moisturizer personally, because I'm up in the mountains all the time and doing a lot of crazy things outdoors. So personally, that's a gift for me. I can't wait to get that. If anyone is out there and they're trying to get a hold of a trusted resource for all of the things that a med spa can offer and then some, where can they find you? Of course, we're going to put a link here. If you go to Mentors and Moguls Podcast.com/Dr. Selene, we'll have all of her contact information, but can they follow you on social media? Or do you have a website that you can share with them as well right here?
Yeah, I would say follow me on social media. Follow me. It's Dr. Selene on Instagram. Even if you're not local and you'll never visit us in Northern California, just follow it just so you can get educated, because we'll tell you the things that maybe your injector elsewhere won't tell you. So this is the honest truth. This is what works. This is what doesn't work. This is what to look out for. This is how it works. So just follow us, even just for education alone.
I agree with that. I totally agree with that. Now, one of the wonderful things about you is that you are not just a med spa injector. You are a full-blown doctor. You actually are kind of like the Doogie Howser of doctors. So let's dive into that, because if you don't know anything about Dr. Selene and her qualifications, you're about to find out. Tell me, how did you get your start? You were an ER doctor. You went to med school at a ridiculously young age, so you were a very smart cookie. Can you kind of walk us through your early history? Because I think that's very important to saying this woman knows her stuff inside the ER and inside the med spa.
Yeah. So I grew up, I'm a daughter of two immigrants who are just high school trained. Nobody had gone to college, so a formal college. And so I always knew as a little girl that I wanted to be a doctor. It was kind of my goal. And so I also have a really low attention span. So I have a little ADHD. I thought school was a little boring and I was underwhelmed by it. So I actually graduated high school at 16 years old because I knew that I wanted to become a physician someday. So I launched right into high school, right into college, got into UCSF medical school, which was in the top 3 medical schools at the time. What a huge honor that was for me. I was the youngest in my class at the time, and I had never left home because I was only 21 when I started medical school. And I knew that I wanted to do aesthetic medicine someday. Botox had not been discovered yet. As for aesthetic medicine. So it was brand new, kind of coming into the world, but I knew that I loved beauty. And so I knew that that's what I wanted to do. During medical school, I looked into all the different practices from OB-GYN, plastic surgery, dermatology. At the time, dermatology was just too boring, just burning off moles and skin cancers. And I was like, that's not for me with a low attention span. And then plastic surgeons were just a little too mean at the time with their culture that has since shifted. And so ER was beautiful because you got to do hands-on work and do mini surgeries in the ER and fast pace. And you knew a little bit about a lot of things, which was really inspiring to me. I also knew that I wanted to do some third world medicine when I was in medical school. That was really the ultimate goal of going to medical school, was I wanted to be a doctor without borders. And I had grown up my whole life doing charity work with my parents in Southern California and crossing the border. And I'm Mexican myself, so it's certainly a passion of mine. And what I found was that ER was probably going to give me that best avenue to do that. And so that's what I specialized in. I did that for a good while. I learned how to be incredibly efficient, really notice emergencies, be proactive on safety. And at the time, I also got my MBA once I started to do emergency medicine. I started my aesthetic business as a side hustle as my charity. So it was 100% of all the profits went to plastic surgeries in third world countries. And I would visit them and would give them all the funds of whatever I made. It was 100%. So at the time, Tom's shoes had just come out, and they were saying shoes for shoes or something along those lines. So I said beauty for beauty. So I would just support a ton of surgeries out there. Well, my aesthetic practice grew really quick. And so I realized that I was spending just as much time in my charity work as I was ER medicine. And as I would go out to Africa or Mexico, I'd see that really what they needed was our funding to help them with their local doctors to do a lot of these procedures. And so I thought, well, I need to make my aesthetic practice as profitable and as successful as possible so I could do the best in the world out there and fund those efforts that they were doing in third worlds.
Very admirable. So I don't know if you all heard this or not, but she managed to be an ER doctor at an incredibly young age. You weren't just an ER doctor. You had a lot of responsibility there. You're being very modest about that. And then you got your MBA while you were an ER doctor, and then you opened a side business. Hello, underachiever much?
Or just get bored really quickly.
Wow. That's more than most people do in an entire lifetime. That's amazing.
It was fun. I am so grateful. Even when I was in my MBA class at University of Tennessee, I think I was the youngest one in there, and just to rub shoulders with these other hospital CEOs all across the nation, man, what an honor just to learn from them. And I've typically been the youngest in a crowd. And I just feel like I've learned so much from people's mistakes that have gone before me and even their successes. It's like, how do I do that in my own life? And so it's been a huge blessing just to be a part of all those efforts.
Well, your business is a thriving business. As I mentioned, it's the number one of its kind in the country. And that is all attributed to you and you, I think, trying to give back and do good work. I think it comes full circle. So I applaud you for that. I think it's really amazing. You're a great role model. Of course, Mentors and Moguls, you're a great mentor. I know you're on your way to becoming a mogul. So that goes without saying. Is there any advice that you would give someone that would like to pivot and change their path, even though it's kind of scary? Because I'm sure, well, you're pretty self-assured in what you want to do, but not everybody is so self-assured. But here you've gone to medical school. You were all set. You had a very high ranking at the hospital. You were in the ER. Most people would say, okay, enough. I'll deal with all of the unsatisfactory things that I have to deal with and just kind of sit on myself with things that I'm not pleased with. But you decided to jump ship. You started a whole new business and became an entrepreneur at that point. That must have been a little bit scary. Did you have some sleepless nights or were you just heck bent? What would you tell someone that's facing something similar in their profession?
Heather, it was a lot scary. And I actually, at the time, I felt like I was turning my back against what I had been trained to do. And at the time when I was looking into aesthetic medicine, I actually had shame behind it. I remember going to some lectures on aesthetic medicine, and I ran into a friend in the line at the airport, and he asked me where I was going. I said I was going to some training, and I was embarrassed to tell him that I was going to go learn how to do Botox. Wow. And I had a really good job. I was the assistant chief at the hospital that I was at in the emergency department. I was on multiple boards, and I had a really secure salary there. And I remember writing down all the reasons why I should stay and all the reasons that I should go. And I really felt like I was selling myself short in my heart of hearts. And so even though I was a really good ER doc and I had trained for that for so many years, and I was in a really elevated position within the hospital, I knew that that's probably not what I was created for. And there was this unsettled position in my heart that I could not ignore, but to walk away did take bravery. And I always say bravery is doing something even in spite of fear, because it did feel fearful. I've always felt like I personally have found a lot of security in money, which I don't love about myself, but that's one of the areas that I struggled with growing up poor, is that I found security in money. So to walk away from a $300,000 a year salary to the unknown felt very uncertain to me and was a big step. I talked about it with my husband, and I said, should we do this and transition out of this security into something that's really unknown? I don't know if I'll succeed. I think I will, but I can't be certain. And we both agreed that let's try it. I mean, you only live once, do what you love. I loved the people that I worked with in the ER. I did not love the practice of political bureaucracy or things that, really tied my hands as I was continuing to practice. I didn't get to do I didn't get to think for myself anymore at a certain point in medicine. And I was tired. And when I looked at my colleagues, they weren't happy in life. They were just going in and clocking in and really unhappy with their career choice. And unfortunately, I still continue to see that in a lot of my friends who I used to work with. And now it's like I get to live my dream, and play and work is the same to me. And so I feel like I love what I do, and the financial benefits have come just from doing what I love and what I'm passionate about. And even had it been just turning away from medicine altogether to do something differently, I say, go for it. You only live once. And so be brave, do it, push through it, hustle. Usually if it's something that you're passionate about and love, the fruits of your labor will shine through.
That's right. Well, you do have a thriving business. So it's is it 10 years later? How long have you been doing the med spa?
Yep. Yeah, officially a decade.
Okay. So 10 years later, and you don't regret your decision. It was well worth the fear. How long did it take you to finally say, okay, I made the right decision after you jumped?
So I would say that even for the first 2 to 3 years of being in aesthetic medicine, I was still nervous about doing what I did. I feel like in what I do, it's a huge responsibility to someone. It's their face. Mm-hmm. So it took a long time for me to get comfortable in my own skin in this new position. Of course, I was used to life and death in the ER. So that helped prep me for, being okay with fearful situations. But after 2 or 3 years, I was like, I really did make the right decision. And I did not go back to the ER once I jumped.
Love it. I love it. I love it. Well, that's great advice for anyone who's just kind of sitting on the fence, but you searched your heart, it sounds like, and you just went for it. So I think that's fabulous. Well, Dr. Selene, I could talk to you all day, but for now, I'm going to say adios. Thank you very much. And we will tune in a few months when you're ready to launch your latest product, and we will share it with the listeners and see if we can get some people out there to try it and give you some great testimonials as well.
Thank you, friend. I really appreciate this time together.
I love seeing you, and hopefully we'll see you very soon. In the meantime, stay well and have a blessed day. Thanks so much for tuning into the Mentors and Moguls podcast. If you enjoyed today's episode, rate and review this interview and share it with a friend who could benefit from today's guest. You can find bonus video episodes at mentorsandmogulspodcast.com or check out our events page and our blog at heatherrstone.com. Until next time, make it a great day.